Hey guys, it's Dr. J here, live in the flesh. Happy Monday. I was in Kansas City this last week. Happy to be back in the office, ready to connect. What's on your guys' mind here? I'm live on Facebook, live on YouTube. What do you all want to chat about? Let me know what's cooking here. All right, so off the bat, what's hot in functional medicine world? It's a good question. Lots of good topics in the health world. We talked about in the past, we talked about building healthy, strong teeth. We talked about collagen. We've talked about SIBO. We've talked about thyroid. I got a thyroid book coming out sometime this summer or the end of the year. It's pretty much done. I just got to go through the rough draft again. So thyroid's a really important topic to me. I think a lot of people have issues with their thyroid. And conventional medicine typically is all about prescribing a drug to make the TSH look nice and pretty, but the patient necessarily isn't getting to the root cause, and they may still have a lot of thyroid symptoms left over. So we always want to get to the root cause of what is underlying a lot of the thyroid issues, whether it's a gut imbalance, whether it's gluten sensitivity and autoimmunity, whether it's a leaky gut, whether it's some type of liver toxicity issue. We can't forget that 80% or 60% of thyroid hormones actually converted and activated in the liver. So we have to make sure we have optimal, healthy liver function so we can convert that thyroid hormone. If we are eating pesticides, if we're gluten sensitive, we have gut bacterial issues, if we're nutrient deficient and not having a lot of those precursor nutrients to convert T4 inactive to active thyroid hormone T3, selenium, zinc, magnesium, vitamin A, copper, various herbs can help as well. This is really important. Let me dig into some of the questions here. Hey, Spivey, hope you're doing well. Bob writes in, Dr. J, what do you recommend for a GI map showing Giardia and Entamoeba coli? Well, we would use various herbal protocols to help knock that out. So in my line, we would probably use something like, again, if it's only those two parasites, we would do something like a GI Clear 1, 4, and 5 in my line to knock those suckers out. If there's other critters there, we may have to sequence other things. But of course, we'd want to make sure the adrenals are fully supported and dialed in first before we did anything else, because that's super important. And the diet component is important too. Can you discuss nitrates? Nitrates, I think, are important. Again, you're going to get them in a lot of plant-based foods. They're going to be in a lot of curing agents for like bacon and those kind of things. But if you look at the amount of nitrites that are in plant products, celery, those kind of things, they're really high. I think nitrates are overblown. I'm not too worried about it. What are virulence factors for H. pylori? Well, there's a couple. There's like a VAC-A, a VIR-A, a VAG-A. These are just cytotoxic proteins that are produced by the infections. And of course, the more virulent, the stronger the infection, right? Hence, virulent factors, the more these cytotoxic proteins are going to be produced, essentially. And the more these cytotoxic proteins are there, increased chance of inflammation, gut irritation, stomach cancer, et cetera, et cetera. So getting those cleared out is going to be helpful. And we knock out the H. pylori. We do all the things to get inflammation under control, and you can see those really start to improve. Let's continue to roll here, guys. What's the best way to lower chronically elevated cortisol before treating the gut? And how long should a protocol consist before attacking the gut? So when we deal with chronically high cortisol, it's going to really depend on the physical, chemical, and emotional stressors that person is dealing with. So when I sit down with patients, we really do an audit of what I call the SSS approach. We look at the underlying symptoms that are present. So let's say there's fatigue and mood issues and brain fog and acne and bloating or gas. Those symptoms are helpful to know about. In the conventional medical world, typically a drug is prescribed to treat that symptom. The problem is that drug does not fix the underlying upstream system dysfunction, whether it's hormones, gut, infections, detox, nutrient. It doesn't fix any of the underlying systems. So we look at the symptoms that are downstream. We trace them to the systems that may be out of balance upstream. We do testing on those systems, and then we look at the underlying stressors that are at the very, very top. Stressors could be physical, chemical, and emotional stressors, and that could be things like exercising too much or too little, chronic pain and inflammation, gluten sensitivity, infections, nutrient deficiency, toxicity, etc. So we look at all these things, and then we kind of come up with a plan to make sure the underlying stressors are addressed. We do testing to look at the system so we know where those systems are at from a functioning standpoint. And then we can give certain nutrients to help some of the symptoms. That's possible. We just want to make sure we're not ignoring any of the upstream system issues. And we also want to make sure the underlying stressors have been fully addressed as well. Okay, excellent. Let's keep on rolling here. What kind of sunscreen do you like? I go for a mineral-based titanium zinc oxide, but should I avoid titanium dioxide? Again, I typically would use skindeep.org or the Environmental Working Group database, but I think a good zinc oxide or a nano zinc oxide or a titanium oxide, I'm okay with that. Again, a lot of the other sunscreens are like the oxymethoxycinnamate. These are like chemical issues and they can be carcinogenic. So I'd rather use kind of the physical deflectant, i.e. the zinc and titanium, versus the chemical absorbent, which is going to be the ones in your conventional sunscreen. So I use like Marie Veronique, Michelle. Michelle is a great one that sprays on. There's a couple other ones that are really good, but go check out the Environmental Working Group site and look at this. Their skin cosmetic database. Neem writes in, on a SIBO diet, should you avoid soups with herbs because the herbal teas could be high in FODMAPs, or just add the herbs right at the end of the soup? I would say it depends on the herbs. If we're talking herbs like garlic or onions, like kind of in that kind of sense, I would say be careful with them. But other herbs, maybe like parsley or ginger, they may be okay. So I would say look at the FODMAP content of the herbs, and if you're very sensitive, then I'd pull them out. James writes in, happy Monday. What do you think about Matula tea for H. pylori? I think it's good. It's something that I've used in the past. I think it's good. There are other herbs that I've had good success with as well. Bob writes in, do you think the body makes unusable thyroid hormone from fluoride and it shows up on the thyroid hormone test but is inactive? It's a good question. I just know there's been studies. There was one study that came out 2 years ago that looked at fluoridation and thyroid, hypothyroidism kind of epidemiological data. So like it said, okay, these communities use the most amount of fluoride, and then here is the thyroid, the hypothyroid incidence in these communities. Is there a statistical significance in the communities? Does more fluoride in the water equal more hypothyroid people in the area? And that was actually shown to be statistically significant. So the more fluoride in the water, the more hypothyroid people in the area. And then what's the mechanism there? Well, iodine is a halide. It's in that 7th row of the periodic table of elements. And if you look down below it, you're going to see fluoride in there as well. So the mindset or the mechanism is that the fluoride is pinch hitting in the iodination process and it's not iodine, right? So it's going to decrease the iodination process, which is going to decrease the amount of thyroid hormone that is being made. So that's kind of the mindset. So definitely keep fluoride out of your water. It's not a real natural process. Again, if it's like a calcium fluoride that's naturally occurring, that's different. Most fluorides that are in there are hydrofluorosilicic acid, which tend to come from fertilizer and bomb making industries, and they're just dumped in the water. Again, you can look at Christopher Bryson's book, The Fluoride Conspiracy, for more intel on that. Let's see here. Can you recommend a good brand of trace mineral drops that you can put in water throughout the day? Yes. So I like Real Salt. I think that's great. You can also use Trace Mineral Research. They have some good ones too. Endure one that's great. Is it possible to fully kill H. pylori in only 3 weeks? Treatment with GI, Microbex, and Bio-HPF? Hard to say. 3 weeks is definitely too short. I would go longer for sure. Nora writes in, Dr. J, quick question. Can I have my thyroid blood test and GI map test done if I have some oil of oregano and a sore throat a week ago and I have an ongoing cold? Typically, I would say finish up the antimicrobials and wait a week is a pretty good rule of thumb. At what point do you use antibiotics for H. pylori? Which ones do you use? Great question, Charlie. So typically, if we're talking about H. pylori and antibiotics, I would typically go through 2 to 3 rounds of herbals before we go to the antibiotics. I find a lot of people have H. pylori and other infections, so it's very rarely H. pylori by itself. So I want to make sure everything else is kind of done first. And then if we have to go to antibiotics, we typically do like a triple therapy without the Prilosec for the most part. Like if we don't have acid reflux or burning, we would do like a clarithromycin or an amoxicillin, probably just the clarithromycin first. Soluble corn fiber, is that okay as a food product? I would probably stay away from the grains, especially the corn, because there's probably a lot of Roundup residue in there unless you know it's 100% organic. Matt writes in, what would you make of the mitochondrial support subs like the lower B vitamin and CoQ10 no longer providing energy support for the first few months? It's worked great, but lately seems to not help. Depends. I mean, I want to know, are there any additional, are you talking about just from a symptomatic standpoint? If you're noticing less energy, I would just want to know what's going on with underlying stressors. If there's too much stress going on, you can only supplement your way out of energy so much. So I would just want to make sure stress is under control. Diet's really good. Sleep is good. And then if that's all right, then I would just say you're on the right track. And I would probably use some adaptogens. Again, it depends. I need a little bit more information to give you more feedback. Gabe writes in, currently dealing with autoimmune issues. I'm currently drinking green smoothies once a day with your collagen protein powder. Is it possible to develop an allergy to drinking smoothies every day? It's going to be less likely because they are blended up really well. So your body's not going to have an issue breaking them down. I think that does help. The collagen peptides are broken down already very, they're pretty much ready to go into the bloodstream. So I think that process is going to make it easier on your body to not develop an allergen for sure. But if you love it, rotate it. You shouldn't be doing the same thing every day. But I think how you're processing it and making it helps. And if you're doing a green smoothie and you have gut issues, I would look at sauteing or steaming or cooking down some of those greens so you can break down some of the phytates and the oxalates, which could be an irritant. Charlie writes in, can blastoparasites be passed on to a partner? What about other parasites in general? Yeah, of course it can. Especially, if there's intimacy or, sexual contact with partners, of course, fecal, oral, sweat, things can move around, right? And that stuff can be passed back and forth. You guys can use your imagination on that. So for sure, definitely can. And even with kids, even though there's not going to be any intimacy like that, things like H. pylori with saliva, you're just kissing your kid in a non-sexual way, or you're sharing a drink or a spoon, that may be enough. Typically, that may not be enough on the parasite side, unless your kid's really young and you're changing their diaper a lot. There may be something there if you're not washing your hands. If your kid gets something, let's say the dog licks the kid's got something, you're washing, you're doing the diaper, and you're not kind of getting your hands sanitary after each time, you may have a higher chance of getting it from an infant for sure. So be careful of that. But I would say if you have a partner, for sure, if you have some major gut issues, get your partner checked, or at least get your partner treated, just to be on the safe side. Let's see here. Rosa writes in, can I drink Lugol's iodine? I have nodules in my goiter and my hormone levels are normal. Be careful. Lugol's is very, very high. If it's a 2 to 5% solution, you're looking at 2 to 3 to 5 milligrams per drop. So I'd be very careful if you're drinking that. Are we talking 1 drop at a time? I would start very, very low, couple hundred micrograms, and I would taper your way up slowly. I'd make sure you have all the underlying stressors and body system stuff in place before you go too heavy on that. Matt writes in, I've noticed that dopamine support, NALT, what does NALT stand for? Let me know. Has helped less with energy. Sleep has been solid, not much stress. Diet solid and more energy with more keto, but fatigue seems to have returned. So if you're going more keto, I don't understand how you're squaring the fact that you have more energy with keto, but you're complaining of fatigue. So let me know about that, because it could just be you need a little bit more carbohydrate. But if you're saying keto is helping with your energy, then you shouldn't be complaining on the other side that your energy is low. So let me know. What are your favorite adrenal adaptogens? Great question, Bob. Eleuthero, ginseng, ashwagandha, rhodiola are phenomenal. Of course, at night you can always do things like valerian or melissa officinalis. You can do holy basil. These are great to kind of lower your cortisol. And then it just depends, right? I love ashwagandha. Like my ashwagandha supreme is awesome for anxiety and sleep and mood. It's a great multitasker. Ginseng's great increaser of cortisol. Rhodiola is a really good balancer of mood. Eleuthero really helps with sex hormones. So there's a lot of different reasons for each. Maca is also great. I will use that more in my female hormone patients because it really helps modulating the sex hormones too. So I'm a big fan of that. What would you do to overcome a plateau after dieting for a month on paleo AIP? Well, if you're on a plateau of paleo AIP, it's time for a reintroduction phase. And I have a handout that I give to my patients on how to reintroduce autoimmune foods and potentially low FODMAP foods. So I would look at the reintroduction for more info, but it's going to be 1 food per 2 to 3 days, smaller amount on day 1, work your way up and really do a good audit as you add things back in. Do you have any negative reactions? Charlie writes in, so frustrating. I could get rid of all my parasites and H. pylori, and my partner could give it back to me. It's definitely possible. Again, if your partner is doing pretty well symptomatically, they may have a strong enough immune system to not even have it, right? But I think it's good, like if you have an infection and you don't want to test because of financial reasons, at least put them on a good broad spectrum parasite support like GI Clear 4 or GI Clear 2 for the H. pylori, just to make sure that you at least are knocking it down. Chris writes in, what's up with reverse T3 causes and remedies? So reverse T3 can go up. It's an inactive thyroid hormone. So it's like you have a gun and you put blanks in the magazine cartridge. So then when you go to shoot it, you get the noise, but you don't get the actual bullet. It fits into the same receptor site as T3 would, but doesn't have the same metabolic effect. And again, the causes are going to be adrenal stress. So anything that's going to be physical, chemical, or emotional stressors can increase it. And things you can do to help reduce high reverse T3 are going to be selenium and any liver support. So milk thistle, silymarin, those type of liver tonifying herbs will help knock it down. But you just got to make sure you're getting to the root cause. Let's see here. James writes in, are you adding extra GABA and ashwagandha after you visit the in-laws? Hope it was a success. Is there too much ashwagandha? Can you overdose on it? Well, I think ashwagandha 1 to 2 grams a day is fine. I have no problem with that. And no, my trip was pretty stress-free, feeling good, but I always keep a bottle of liposomal ashwagandha on my desk. It's actually in my bag. I got to go get it in between patients here. But I think it's a phenomenal way to deal with stress. Also, doing kind of the tapping stuff is really good. And then, really good visualization, focusing on gratitude's also really helpful. And I also have my M-Wave device over there in the corner. Those are my 2 big ways I nail that. Is sodium ascorbate a good form of vitamin C to take, or would you recommend it? Sodium ascorbate, not too sure. Typically, I'll recommend a lot of vitamin C that's going to be like an ester C, which tends to have like a mineral bound to the vitamin C, which I think is good. I like the bioflavonoids bound to it as well. Hey, Alimo. Matt writes in, N-acetyl tyrosine. Okay, got it. And more keto, higher fat has helped with energy. Carbs seems to cut my cortisol too much. Just trying to find some other approaches to what's happening with the fatigue. So, I mean, I would say if your fatigue's getting better and the carbohydrates are dropping, that's a good sign. So you should be doing well then with the mitochondrial support. If you're noticing that the fatigue is increasing at certain times of the day while you're cutting the carbs, I would play around with the carbs first. Nancy writes in, I love collagen, hydrolyzed beef collagen, one of my favorite go-to supplements. I'm a huge fan of it too. I think it's great. Is there a case where you can supplement too much with tyrosine? As long as you're getting 5-HTP, I assume a tolerance will develop, but not sure if too much tyrosine will cause any thyroid problems. I would say, keep it between 1 to 5 grams. You're probably going to be fine. If you go too high on it, I think you're going to get some jitteriness, some anxiety, a little bit of kind of wiry feeling. So I would use those symptoms as a pretty good gauge. And of course, just checking in on an organic acid test and look at the metabolites of tyrosine, the vanilmandelate and the homovanillate markers on the organics. But again, if you're under stress, your body will use it and burn it up more. So keep that in mind. But I would let those symptoms kind of guide you. How much vitamin D to take when you get sick if one serum concentration is pretty high otherwise? I would do 100,000 IUs for 3 days. It's going to really help upregulating the cathelicidin enzyme, which is a natural antibiotic, which will help kind of kill any bacteria. So I'm a big fan of that. Hey, Sherry, hope all is well. Any recommendations on product or supplements for wrinkles? Yes, great question. So I like collagen internally. Collagen's phenomenal. Also, vitamin C serum is going to be great. Vitamin C serum is going to be great. You can also do retinol, like a vitamin A kind of retinol product on your skin. If you're female, be careful because high doses of vitamin A can be teratogenic, meaning it can cause birth defects. So if you're planning on getting pregnant or there's a potential for pregnancy, be very careful with higher dose vitamin A. But that's great. And then, of course, you can do like some needle rolling on your face, and there's some laser things that can also be helpful. But I would really hit the natural compounds topically and then the internal collagen for the inside. Hope that helps. Let me keep on rolling here. A lot of questions. Ramona writes in, how do I know if I need pancreatic enzymes? Also already taking digestive enzymes. What's the difference between the two. Typically, digestive enzymes are going to be almost the same thing, right? You're going to have enzymes like pepsin, which are primarily going to happen in the stomach, right? They're sort of more gastric enzymes. You're going to have proteolytic enzymes that are going to be more pancreatic based, right? You're going to have like proteolytic enzymes, which are kind of like a family of things like trypsin or chymotrypsin. You're going to have various lipolytic enzymes, which are fat digesting enzymes from the pancreas. Proteolytic enzymes are going to be protein enzymes from the pancreas. And then, of course, you're going to get bile salts, which are going to be from the gallbladder. And then you'll have some amylase, which will happen in the mouth and in the stomach, which are going to be more carbohydrate digestive enzymes. But for the most part, a lot of those enzymes are going to happen in the pancreas, which will then be stimulated by healthy pH levels and acidity from the stomach. So the stomach hits that first domino of a nice low acidic pH. The second domino that falls will be that pH, that chyme, that mixed up food that's going to be released from the stomach into the small intestine. That triggers the pancreas to produce those enzymes. And again, like when we do gut testing, we'll look at that elastase enzyme, which is a good marker for internal enzyme production. Alex writes over here on Facebook, can saliva and other tests for AF? What does AF stand for? Help me out. B says another country, to be checked. I imagine adrenal fatigue. That's probably what it means. Be checked. I live in a country where these tests are, man, I wish it would just show it. See if I can show it here, guys. I still can't see it. Okay. So regarding adrenal fatigue and adrenal dysfunction stuff, I use the Dutch testing for outside countries. It just lasts longer. Doesn't have to be refrigerated or in a pack at all. So I do a lot of the Dutch testing to assess adrenal dysfunction in other countries. Let me keep on rolling here, guys. Amy writes in, my 11-month-old daughter was recently on antibiotics for pneumonia. What can I do to build up her gut microbiome? So you want a specific strain of Infantis probiotics. Infantis is the strain that you'd want. And again, I would always try to use antibiotics as a last resort for the kiddos. There's silver that can be used. There's a natural product called biocidin that's herbal and liquid that can be used and dosed according to weight. Potentially oil of oregano. Again, I'd have to Google that to be sure. Some of these things are going to be age and weight dependent, but I would always try to exhaust the natural things before I ever do antibiotics. But again, if she had pneumonia, I would just say it'd be more prevention next time. Like make sure her vitamin D levels are adequate. How do you do that? Is just make sure your vitamin D levels are adequate. That way you can pass enough in the breast milk. So I'd make sure your vitamin D is like 70 to 100 so you can adequately pass enough D to her. And then I'd make sure that you have those things like the silver is a great option next time. But the Infantis strain will help build it back up. Matt writes, and I remember my vanilmandelate, that's lower than the homovanillate, which shows that the norepinephrine rather than the dopamine. But dopamine is a precursor to catecholamines. Yeah, so we're talking about metabolites to adrenaline and dopamine. And of course, dopamine is a precursor to adrenaline. So if those are lower, then we want to continue to support the dopamine and adrenaline pathways with some extra amino acids. That's super helpful. Ali Mo writes in, Jay, still having heart spasms after taking regular electrolytes. So I'd want to make sure your macros look good. I want to make sure you're getting enough potassium, 4,700 milligrams a day. I want to make sure that you're getting enough magnesium, at least 1 gram of good quality magnesium citrate a day. Again, trace minerals are never going to have enough minerals for you for the day, but they'll give you a good head start. But you want to make sure that you have enough minerals. You can look at Chronometer, justinhealth.com/chronometer to see how your minerals are looking from your food. But when I see heart things, I'm going to look, hey, how's your thyroid levels? Are they too high or too low? Number 2, is there any additional adrenal stressors that are going on? And then number 3, how does potassium and magnesium levels look? That's big. Charlie writes in, is your GI Clear 2 for 30 days enough to kill H. pylori after testing positive from a retest? What's your experience? Yeah, I typically would go 30 to 60. I'd probably lean on going 60, Charlie. Neem writes in, thoughts on SBO versus lacto bifido probiotics. So SBO, not sure what you mean by that. So like there's some delactate free probiotics or there's some spore biotics. And if you tend to be sensitive or tend to have more gas or bloating, those can be great options. If you have a hard time tolerating those or have a lot of SIBO in the past, those can be really good. You're totally welcome, Amy. What do you think of chocolate, caffeine for normal autoimmune folks? I think the more severe your autoimmunity is, just cut it out to be on the safe side and add it back in once you plateau. But if you've already done an autoimmune kind of diet and you're still having some food reactions and you haven't pulled it out, I would err on the side of just pulling it out for a few weeks and then add it back in, Chris. You're welcome, Allie. Matt, you're totally welcome as well. Hey guys, I got a patient I got to jump on to. I may be back on later this afternoon for a podcast. So I look forward to checking in with you all then. Last question. Thoughts on green leaf stevia powder? What's better as less refined? However, it still contains all the hormone-like stevia glycosides. Is it better to take refined liquid instead since it only has 1 or 2 grams of glycosides? I would typically lean on the liquid just because it dissolves better and I can dose it better than the powder. So I would lean on that. I like the sweet leaf form. You want to make sure there's no maltodextrin powder in it. And you want to make sure that it's fully organic because a lot of stevia is loaded with maltodextrin. Maltodextrin's corn sugar. And if it's not organic, guess what? It's coming from GMO corn, which means it's going to have Roundup or glyphosate residue in it. So I lean with the liquid, make sure it's organic. I like the liquid dosing on the stevia because I can control the dose better. So I can do a very, very tiny dose. And I like the sweet leaf version. The sweet leaf is great. All right, guys. Awesome chatting with y'all. I'll be back soon. Have a phenomenal day. Take care.